Good evening, everyone. First of all, let me thank Dr. Thomas Cherian and KSOS for giving me this opportunity. I'll be talking on management of OT protocols. As you know, endophthalmitis is the most dreaded and devastating complication of intraocular surgeries, which can lead to a permanent severe visual loss, and it can be prevented only by a strict asepsis. So, how that can be maintained in our OT? So the airborne infections in OT can be prevented by dividing the OT into 4 zones. That's a protective zone, which includes the reception area, the waiting area, the changing rooms, etc. From where we enter the clean zone. That is the pre-operative room or the block room in our case, the recovery room, the doctors and nurses work areas, etc. And then we go into the sterile zone, that is the operating theatre, and then there is a disposal area. Multiple barriers should be provided from the protective zone to the aseptic zone to minimize the contaminants from exterior reaching the OR. And you can keep the doors in a zigzag manner, which will hinder the direct flow of air from outside. The OT should have its own ventilation, which has certain purposes. There should be filtration of air and purification, and also a positive pressure ventilation should be maintained, and there should be laminar flow and a proper air conditioning with controlled temperature, humidity and ventilation. So these are the NABH guidelines for a general OT, under which the ophthal OT also comes. There should be a minimum of 20 air changes with a minimum of 4 fresh air changes, and a positive pressure of minimum 2.5 pascals is maintained to prevent the entry of outside air into the OT. Then air filtration has to be done, and humidity and temperature has to be maintained in the recommended levels. The AHU or the air handling unit must be an air purification unit and an air filtration unit. There should be air is filtered, and finally first by 2 pre-filters and then by the HEPA filter, which has an efficiency of 99.97%, and the air supply at the grill level should have a class 1000 per ISO quality. That is 1000, class 1000 means a cubic foot of air must have no more than 1000 particles of 0.5 microns or larger. And the laminar airflow ensures that the HEPA filtered cool air descends in a unidirectional pattern along parallel lines, and it will prevent the contaminated air from surroundings to from entering the central operating area, and this is limited to the center of the operating room, and the flow of air here is imperceptible, and this should be maintained by strict validation, and it should be done every 6 months as per ISO standards. We should check the temperature, humidity, the air particulate count, air change rate circulation, air velocity, the positive pressure, that is the pressure differential, and the validation of HEPA. HEPA filters should be done. So every 6 months you have to do this, and a validation certificate also you have to maintain, and that should be kept recordically. You should maintain a register, and preventive maintenance can be done every month, and there should be strict rules in an OR which should be followed by all those who are entering the OT. The operating theatre complex should be always kept clean. You should not allow dust or dirt to accumulate there, and it should never be dry dusted. Always wet mopping should be done, and the wet mops should always be cleaned, disinfected and dried. This is the daily protocol, and the aseptic techniques refers to the practices performed immediately before and during a clinical procedure to reduce the postoperative infection. So always remember that skin of staff and patient is an important source of contamination. So from the patient, it is prevented by the surgical drapes with adhesive edges, and in the case of staff, by the wearing of surgical gowns. So these barriers will prevent the entry of bacteria from the skin into the surgical wound. And there may be skin particles may be shed from under the gown, which are prevented from reaching the operating zone by the laminar flow. And always there should be a preoperative checklist according to which you have to check everything when you are preparing a patient, confirm the identity and the operative site. Always you can permit hearing aids, and for cataract surgeries you can permit even dentures. if the patient is being done under local or topical. And informed consent for the surgery as well as anesthesia should be obtained, and the timeout form should be read out before each case. Before and during the surgery, scrubbing of hands, gowning, gloving, draping, everything should be done properly. And always remember that items below the level of the drape are outside the field and they are not sterile. And trolleys should be placed within the confines of the laminar airflow to maintain a sterile field, and any sterile barrier that has been penetrated, either wet, cut or torn, is considered contaminated. Limit the number of people who enter the OR and close the doors during all procedures. And after each case, you should segregate the biomedical waste into color-coded containers, and instruments are returned to the TSSU for cleaning. And all horizontal surfaces which has been contaminated by the procedure has to be cleaned and disinfected. And trolley is set for the next case. So the biomedical waste management, so it should be passed through a corridor, disposal corridor, and first it should be collected in the color-coded containers and then pass through the disposal corridor. And all the registers should be maintained, should be filled, and all the implant labels should be pasted in the registers. And while using the disinfectants, always remember that you should check the expiry date, you should use the proper dilution, and always use a clean, dry container, then and always give adequate time for it to act. And never store instruments in a disinfectant, and never top up yesterday's solution. Always prepare fresh and use it for the day. Documentation registers have to be filled every day, and it has to be maintained. Cleaning of surgical instruments. After a case, the instruments must be rinsed with cold water immediately to prevent drying of blood and other body fluids, and then sent to the CSST for further cleaning. And manual cleaning is generally performed for delicate instruments with a soft brush. Always remember, should not be rinsed under running water, and you should not use saline, you should not use hot water. And the cleaning agents like detergents and enzymatic cleaners can help you in further cleaning, because water alone cannot clean the substances like oils, fats and proteins. And ultrasonic cleaners will help you to remove even the tiniest speck of dirt from unreachable areas like hinges, serrations, etc. And always after thorough cleaning, it should be inspected for cleanliness as well as functionality. And after cleaning, all the instruments are sorted, checked and assembled for sterilization. And always they are put in the perforated steel trays with a liner which will prevent damage of tips, and you should pack them well so that wet packing is prevented. Linen packing materials, that is, linen can be used for steam sterilization, or you can use plastic for ETO and gas plasma. Paper plastic also can be used for steam and ETO. And always use chemical indicators to assure sterilization. And there should be a record kept for sterilization. And each pack should be strictly labeled with all the details so that they can be recalled in case of a problem. And these are the chemical and biological indicators which are used. And always the pouches are to be kept vertically to optimize the air level, air removal, the sterile penetration and drying or aeration. And recall is done in case of a problem. So the whole batch can be recalled from the label. And at the end of the day, wet mopping of OT walls and floor is done. Cleaning of all surfaces has to be done. And after switching off the AC, put the UV on and close the OT. And next day you have to switch off the UV first, then put the AC on, and after 30 minutes you can enter the OT. And air surveillance has to be done to detect the bacterial count in the OT air. We use the settle plate method, where multiple plates are kept in different areas of the OT and results are interpreted as a whole. And at the time of exposure is 30 minutes. 10 to 12 colonies formation unit can be taken as the limit in ophthalmology OT. And always swabbing also should be done. Swabs moistened with nutrient broth or saline, it's used, or distilled water is used to take samples from the surfaces or equipments. And the areas to be swabbed are mentioned here. Swabbing of the air conditioned filters may be done. It's not done regularly. And every week and every month you have to do a thorough cleaning of the entire OT and equipments, followed by fumigation and culture. Monthly you have to take out all the equipments and you have to clean the OT thoroughly. And so the take home messages: let's keep our OR infection free, Strict adherence to the OR protocol is the key to prevention of endophthalmitis. So you have to proper maintenance of registers and correct labeling of the pack trays, and biomedical waste management in the recommended manner has to be done for this. Thank you.
Dr. Girija, that was wonderful. I think what we will do is we'll have a panel discussion. So you can stay back till the end. We can have a panel discussion.
Sure.
And I'll request Dr. Shashikumar. He has written a book. We look forward to hearing you, sir. He'll be talking about surveillance at the gate, what goes in. So while Dr. Shashikumar is putting up, just for one small note, which there are definite protocols, systems in place when a flight takes off. And similarly, in our system for an OT, we have to maintain the protocols very strictly, because if we start making mistakes, which sometimes we do, and similar mistakes the flight people make, they have a lot of crashes. What is encouraging, we were discussing just before the meeting, is that there are much lesser incidents of endophthalmitis happening now, which means most people are following those protocols in a very rigorous manner. So it is not difficult, we can do that.